Venkat, what do you see as some of the priorities that will need to be on top of the list for technology leaders, given that digital transformation is a multi-aspect project? So on the one hand, we've got user experience demands that are rising. Healthcare workers and patients alike want a better experience with healthcare IT and applications. And on the back end, healthcare IT infrastructure has to support these demands to assure data safety. So what are the top things that you see that just technology leaders in hospitals are trying to prioritize?
I think that's right. You listed some of those already, right? I would perhaps categorize the priorities in three buckets, if you will. Number one is, all technology leaders, and I'm glad you used the word technology leader rather than CIO, because we do see the scope and the role of technology and technology leaders within health systems changing, so right, from being CIOs to chief digital officers, chief analytics officers, chief innovation officers, chief data officers, and so on. The first one is really investing in modernization of the technology infrastructure that exists in healthcare, because historically, as in many other industries that have gone before healthcare, there has been a lot of underinvestment in technology, right, from infrastructure to applications to talent, really, even. So that's number one, just, if you will, making up for the technology debt is number one. The second one is beginning to drive, especially if you're a large health system, large traditional health system, for technology leaders, learning how to be the leaders of the innovation agenda and kind of the drivers of innovation within health systems is the second big priority, right? This innovation, both in terms of patient care, in terms of operations, in terms of business models, right, that need to be enabled. All of those increasingly will require a great deal of technology enablement. And so becoming a backroom provider of technology services to an executive leader of innovation agenda, right, is the second priority. And then the third priority really is to do number one and number two in an environment, as you said earlier, of financial stress and financial pressures. And so how to do it frugally with get the most out of the little budget that you have, right, is going to be the third priority. And that will require both getting better at doing more with less in the parts of the technology leader agenda, right, maintaining, using cloud more and so on, or using automation and so on, but also carving out a portion of the budget towards doing new things that they did not previously do, all the innovation pieces.
Given the fact that you gathered all this insight based on research with hundreds of organizations, what did you identify as some of the common challenges that healthcare providers?
There are a few. We do conduct a fair amount of research. I'll call out two or three themes that do come up repeatedly. These are certainly prominent in the US, but I would say that your audiences will find that these resonate even in the rest of the world. Number one, a good number of organizations find that technology investments have lower ROI than they expected or they hoped for. So it is hard to execute big transformative technology programs. I think that is something that they're getting better at. That is something that we see, quite honestly, across other industries as well. So that's, this is an industry that's learning to be better. That's number one. Number two, I think what a lot of organizations are realizing somewhat late in the game, perhaps, is that technology itself, right, is the least of their problems, if you will, right? It's not sophisticated technology that you need to make meaningful change in healthcare. What is required is taking technology that already exists and applying it in a thoughtful, meaningful way that is both gets to outcomes, but is also financially prudent. Right? I think that's the second one, which often it's easy to get excited by new technology that's at the cutting edge, but the vast majority of improvement that we can get in healthcare is through technology that's been there for a decade now. So I think that's number two. And then number three, and this is true particularly in the US, right, is that as an industry, especially within the provider subsector, there has not been as much technology talent as some of the other industries have had. And so doing the things that we just talked about is going to take a lot of new technology acquisition, new technology upskilling, right, over the next several years that, that they're not used to, right, quite frankly, more than any time in the last 2 decades.
Mm-hmm. Interesting. And you didn't even mention interoperability.
Yeah, so look, as an industry, we've been talking about interoperability for a decade, right, since the High-Tech Act. We view interoperability as an outcome, right, of things you do than as a destination. I don't think that we will ever have perfect interoperability. I think it's a continually evolving process where you get incrementally more interoperable to get the results that you need. So there's no perfect universal interoperability. I don't think that the US is anywhere close to that. I don't think that the US will get anywhere close to that anytime soon, and that's okay, given where the rest of the bottlenecks are right now. In a lot of instances, interoperability is not the gating factor, right? It's reimbursement models, it's business models, it's the existence of regulation, right? Those are often the gating factors than just data interoperability alone.
Yeah, and I would add some of the measures that are just as important as interoperability, maybe even more important, are measures like the percentage of your patients that are engaging digitally. If you think about the percentage of your processes that are on the cloud today, right? The amount of your clinical workflow that is digitized, right? The extent to which you use automation for OR and other scheduling. So those are some of the outcomes-based metrics that are, again, maybe even more important than interoperability, which is more of an enabler, certainly relevant, but I agree with Venkat. It's moved a bit beyond that.